right, so let's get started here. Welcome everyone. For those who are watching through online, through Facebook, YouTube, just thank you so much for being here. Today we're really going to talk about we've been doing this 6-week masterclass for your immunity masterclass. Really how to get a bulletproof immune system. And so the first 3 weeks we talked about, really an introduction of the 5 essentials. We talked about viruses, cancer last week, and how to boost your immune system. Because if you want to fight viruses, guess what? God has created your body to fight any type of sickness, disease, virus, cancer, whatever disease, high blood pressure, whatever it is. It's inside of you. It just can't be interfered with. And so what we're really teaching for the past 6 weeks, or really the past 3-4 weeks, is how to remove all the interferences that is stopping your body's ability to heal from the inside out. If you can do just that, your longevity is going to be to 120 years old, which you've been promised. And so this week is one of my favorite weeks because we're going to be talking about the nervous system. The nervous system is really what I do. I mean, this is the reason I got into chiropractic, is because of this nervous system. It's the most important system in your body. So today we're really going to talk about, why is it important to get adjusted? But not only that, why is chiropractic not just for low back pain, neck pain, and things like that? It was never meant for low back pain. It was never meant for neck pain. The first adjustment was actually a deaf man who couldn't hear. He got adjusted. He got his hearing back. And so we're really going to break those things down. We're going to really understand the neurology of not just chiropractic, but every time you get adjusted, your nervous system, things like that. It's very important just to understand why is it important, not just for you, but for your kids, your grandkids, and things like that, to start getting adjusted. And so for those who just got on, if you don't mind, if you know somebody that needs if they're struggling with their health, please tag them, share this with your friends, your family, like it, love it, let me know that you're here, put #healing, something like that. And so, but we're going to get started. Our purpose, and basically, there's a few things I'm going to talk about. What is chiropractic? Why is it so important in your health? Why is it important for you to just get well? We'll talk about, why chiropractic really is for everyone, regardless of your age. Why getting old doesn't mean you have to be sick. That's very important, because there's a dilemma in the U.S. is that, I'm just old. And I'm going to be like this, and so it's like a death sentence. That's never what God meant for you to live by. You have to live vibrantly. And so I'm going to teach you today how to do that. Also, the difference between chiropractic symptom relief care and corrective care. And so, that's a big difference. If you're a patient in the office, we kind of do things differently compared to other chiropractors. It's not just, crack, and then see ya. No, we have all these machines and things like that to stabilize the adjustment, to actually correct it. And so we're going to be talking about that right there. And so we're going to start with the nervous system. Why is the nervous system important? Everybody knows. What does the nervous system consist of? Your brain, your spinal cord. And so, what I believe that the most neglected system in the body is this right here. Because, you don't think about this until what? You get numbness, tingling in your hands, until you get pain, sciatica, or things like that. You really don't pay attention to this until it starts paying attention to you. And so, but it's very important just to understand this system, because it literally controls every system in your body. Your reproductive system, your digestive system, your integumental system, your skin. It controls everything. Because your brain controls everything. If you cut your head off, what happens? That's it, you're gone. And same thing, in order for your brain to talk to anything in your body, it's got to go through your nerves. It's got to go through your spinal cord. It's got to go out your nerves. And so it's very, very important because every cell, tissue, and organ is controlled by this system right here. Who's ever heard of Christopher Reeves? Christopher Reeves was Superman. He was old Superman. So what happened to him? He was riding a horse, boom, fell, and he literally, this top bone, your atlas, which is right here, that's the first bone that your nerves go through. It shifted, and when it shifted, guess what? It cut off nerve supply to the rest of his body, and he gradually started losing everything. So what did Christopher Reeve struggle with? Well, he became a quadriplegic. I mean, he couldn't move his arms and legs. But why did he die? Was it his arms and legs? No. It was actually, his heart stopped beating, so they had to put what? A pacemaker on. His digestive system stopped functioning, so literally he had a colostomy bag and had to massage his colon in order for him to use the bathroom. So all these things had to shut down because it wasn't because, when he fell, he hit his stomach or he hit his digestive system. He hit his heart. He didn't hit his heart. He didn't hit his digestive system. No. He hit right up here. And then everything, life from the brain to the body, was cut off like that. And so, and that can happen to Christopher Reeves with just a little fall to his head, of course, to the ground from a horse. Imagine your kids learning how to ride a bicycle, learning how to walk, things like that. Those things accumulate, and it starts misaligning your spine, putting tension and pressure on your nerves. It may be not as dramatic as Christopher Reeves, but however, if you continue to have one stressor after another stressor after another stressor, guess what? These bones start misaligning, and it starts affecting your nervous system. And so, when it comes to B.J. Palmer is the developer of chiropractic. He's the one who spread it all around the world. And so what he said, nature needs no help, just no interference. I like to say, God needs no help, just no interference. God needs no help. It's already been done. Everything that you ever need is already within you. And so, but if you interfere with it by the things that happen in our bodies, the things you put inside your bodies, the things that we're exposed to, guess what? It's going to interfere with your nervous system. And so it causes like a dysfunction. We call it in chiropractic a dis-ease. And so there's these principles in chiropractic that we really abide by. And one of the things is one of these right here. And so basically I live my life through these principles. And really it's what we've been teaching for the past 3 weeks. And so it's like you put good stuff inside your body, you take bad stuff out, and you clean that bucket. The more your bucket is cleaned out, the better longevity you have. And this is a big bucket because nobody really understands about the nervous system, how it can affect your health. We're going to learn that today. And it all has to do with this right here. Uh-oh. It all has to do with your central nervous system. And this is kind of blurry. You can't really see this. But as your sympathetic and parasympathetic nervous system, it's got to be in balance. Your sympathetic, remember last week we talked about if a tiger was here, fight or flight. You either got to fight the tiger or you got to run. One or the other. And that's your stressful mode. You need that to survive. Everybody needs that. However, people wake up stressed and go to bed stressed. And so they never learn how to adapt or overcome it. And so they have you're in this mode right here, sympathetic overload, for years and years and years. And now your heart stops working. And now your digestive system stops working. Your reproductive system stopped working because you've been in this high sympathetic fight or flight mode for so many years. It's shutting down your immune system. So you're getting more sick and things like that. So this right here, how to have a good nervous system, these two have to be in balance. Your parasympathetic nervous system is where you rest and digest. That's what helps you go to sleep, helps you calm down, helps you focus, things like that, helps you digest, absorb your food. Like this has to be, you need this and you need that. You just can't have too much of this, you can't have too much of that. And so, and really when you think about drugs, majority of drugs takes you from this to that. And so it slows you down. It brings you down. But every time you get a chiropractic adjustment, guess what? It takes you from here to there. It brings a balance between your nervous system. And that's what people need in order to function at 100%. And so when it comes, as you can see, your spine controls everything. And what we're going to talk about is really your nervous system. And so, as I said before, your nervous system controls everything. How I know that? Because if I cut the nerve to the heart, what happens? It dies. And so, but how about because of different, I'm getting ahead of myself, but there's many things that causes your spine to misalign. The nervous system is the most important system in your body because it's completely surrounded by bone. It's the only organ that's completely surrounded by bone. Your skull is surrounded by, well, your brain is surrounded by your skull, and your spinal cord is surrounded by 24 movable vertebrae. And so when you look at a spine, it's supposed to be straight, like this. So it's supposed to be straight up and down. It shouldn't look like this. If it looks like that, what is that called? Scoliosis. That puts a lot of tension and pressure right here on these nerves there. And so it's supposed to be straight. It should have 345-degree curves right here. What I'm seeing day in and day out, because everybody's on their phone, everybody's on their computer, their spines are like this. And with a straight neck, guess what that's doing? That's putting a lot of tension on your spinal cord. With more tension on your spinal cord, guess what? There's more neurological issues. Lack of focus, concentration, headaches, balance, coordination, things like hormonal issues, irritability, lack of sleep, things like that, because you have constant tension. You're in constant sympathetic mode because this is interfering with your body's ability to heal. And that's because of this right here, or constantly going down, looking down, because we fight gravity all the time. And that increases your chances of arthritis, joint pain, neck pain, numbness, tingling, things like that. So why is that so important? Because a lot of people, when we look at this, these nerves don't just go to your shoulder or down your arm or to your neck. No, they also go to your organs. And so very often when I see a neck that's going the other way, I always ask about their thyroid. Because why is that? Because these nerves right here in the middle of the neck, they go straight to your thyroid. And so very often I've never seen a person come in with thyroid thyroid problems, and I've never seen a good neck and a good neck and a bad thyroid. I've always seen a messed up neck and a bad thyroid. I mean, almost 100% of the time. And so, and as you can see right here, because when there's tension and pressure on these nerves that go to your thyroid is not functioning at 100%. Because guess what controls your thyroid? Your brain. But in order your brain has to send a signal down the spinal cord, out the nerves to control your thyroid. And so it's like a water hose. When you're watering your plants, you kink it. Well, you kink, guess what? There's not enough water to do it, to go through the water hose. Well, that's exactly what happens right here in your spine, in your spinal cord. When you look at the base of your neck right here, those are the nerves that go to blood vessels of your head. So a lot of people get these throbbing headaches. And there's a lot of tension and pressure right here on these nerves. And that's exactly what happens. Same thing with your upper back. You ever seen someone like this right here? That puts a lot of tension and pressure on the nerves that go to the heart and to the lungs. Because of the amount of pressure there's on these nerves right here. Your brain is trying to send signals to your heart, but guess what? And so it's getting interrupted right here, so your heart is not going to function at 100%. A lot of the times you don't feel these things. Like, the reason is because that's how God designed it. And so, like, research is now showing that it takes 60% function of a nerve in order for you to actually start feeling symptoms. So that means you have to lose 40% function of that nerve in order for you to start feeling pain. Which is unbelievable, because what happens at 80% of that function? What happens at 70%? You don't feel it. That's why when we think about cancer and diabetes and heart disease and heart attacks, like, what do they all have in common? You don't really feel them until what? It's too late. And it's been shutting down for years after years and years. You know, the American Heart Association is now saying that it takes 10 to 15 years for you to develop heart disease. Some oncologists are saying, there's a research article in, I think it was Johns Hopkins, and they said that it takes about 8 to 10 years for you to start developing cancer cells. That becomes more evident, or that becomes more detectable in the most sensitive medical technology today, like a PET scan. We talked about that last week and things like that. And so when we think about these things, like some people's bodies are shutting down, they don't even know it. And it has a lot to do with the neglection of your nervous system. Same thing, I can go down here. I mean, with the nerves that go to the colon, to the kidneys, to your reproductive system. I can't tell you how many times a woman comes in here, a family comes in here, parents come in here, a couple comes in here and says, "Hey, my wife can't get pregnant. We've tried everything. My wife can't get pregnant." And literally, after a couple of adjustments, we turn on this nerve that goes to the reproductive system, and all of a sudden, they get pregnant. How does that happen? It's not me magic hands. When you take pressure off this nervous system, guess what? Your body begins to function at a better rate. Your body, there's vitality, there's life within you that's been withheld. And so it all has to do with this nervous system right here. And so I remember it was really one of my first few patients in the office. It was a woman who was very afraid to say that she couldn't get pregnant. And finally I got it out of her. And she said, "Yeah, I just can't have kids, like all my doctors are saying I just can't have it. I need some injections and things like that, my utero and things like that. I don't want none of that." And literally after a couple adjustments, she comes in so excited. Before I came in the door, she jumps. I'm like, "What's going on? You okay?" It's like, "Yeah, I'm pregnant. And so that was her, and I'm like, "Oh, okay." She actually said, "You got me pregnant." I was like, "No, I did not. I did not get you pregnant." And so, but she got pregnant, and now she has 2 kids, wonderful family, and things like that, because of taking pressure off this nervous system right here. That's how important it is. And so I can give you again, story after story. But when it comes to chiropractic, we have to know what a normal position is. I kind of went ahead of myself, and I told you about the normal position. It's got to be straight from front to back, and it has to have 3 45-degree curves. In this position, your body can function 100%. But because of things like, I call it the 3 T's. The 3 T's are really thoughts, toxins, and trauma. Trauma, toxins, and thoughts. And so the 3 T's is basically your thoughts, your emotional, what you believe is very important. That will get you subluxated. What is a subluxation? That's a chiropractic term. Scientific term, but chiropractors use it when it talks about a subluxation, basically due to some type of trauma, toxin, thing like that. These bones misalign. And when they misalign, it puts tension and pressure on these nerves coming through these little holes. That's what we call a subluxation. It takes pressure on a nerve that's causing interference between the brain and the body, and the body and the brain. And so when I use that term a lot, subluxation, just to when you're subluxated, you're not functioning at 100%. When you're unsubluxated, guess what? You're functioning at a better rate. It may not, according to how much damage you have in your spine, you may not ever reach 100%, but you can get as close as possible to it. And that's always the goal. And so, but in this position, when there's anything other than this position, you're subluxated. And so, and how to detect an abnormal position? X-rays. I just had a patient come in yesterday and said, she couldn't move her neck. She couldn't do, she was having headaches. She was having all these things. And she said she went to another office, and they just sat her down, clop, 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 clop. See ya in 2 minutes. Never took x-rays, never analyzed her, things like that. So the reason I take x-rays is because I never want to guess of what I'm seeing. I need to know exactly what's going on, because if I can't see through you, I don't have x-ray vision. So that's why I take x-rays, to know exactly the position of your spine. Is it crooked? Do you have forward head posture? How much degeneration you have? I don't typically use x-rays to know what to adjust to you. However, it shows me, okay, how much damage there is. I have to know how much damage there is in your spine. That's why we take x-rays. That's why it's very important. If you're watching this and you don't go to a chiropractor, like, you gotta get some x-rays of your spine just to see the health of your spine. Because guess what? You only have one spine. You can literally, you can get as many teeth as you want right now, if you have the money for it. you can replace your teeth. I mean, hopefully y'all are brushing y'all's teeth. However, like, have you ever brushed your spine? And so these wobble cushions that we have in the office, every time you get an adjusted, it's like taking care of your teeth. You just got to take care of your spine. The more you neglect your spine, guess what? The more it degenerates. The more you neglect your teeth, guess what? The more cavities you have. It's very, very, very similar. And so, like, it's very important to understand why we take x-rays, what's an abnormal position, and that's why we take x-rays. And so, subluxation on x-rays, like I said before, so many people worry about their teeth, but you only have one spine. And so you have to take care of your spine for the rest of your life. And so, like, same thing with your teeth. You got to take care of your teeth for the rest of your life. And so, how do we get subluxated? I kind of already said about the 3 T's. And so it's thoughts, toxins, traumas. And so why is this so important, though? Because let's say you lose somebody in your family. Because of this COVID crisis, a lot of comorbidities and things like that, a lot of people are dying, things like that. But honestly, in 2020, they had the same amount of deaths in 2020 happened in 2019. Despite of all these things going on and things like that. And so because people are still getting heart disease, so people are still getting cancer, people are still getting diabetes, and so they have all these conditions, but they're just putting Band-Aids on every symptom. If you put Band-Aids on every symptom, you're going to be full of Band-Aids, but you're never going to get down to the cause of the problem. You got to get down to the cause of the problem. And when it comes to subluxation, your thoughts are very important. When you see somebody full of anxiety, depression, and how a man thinketh, so is he, that's exactly right. I mean, when people get a diagnosis, they get discouraged, they get subluxated. Your body reacts to what you say and what you think. And so when just think about it of a thought. Let's say somebody passed away in your family. Guess what? Your body's like, yes, you start feeling sad. You get like this right here, because you get tension up here. You start crying, things like that. Guess what? It starts changing your spine just by the news that you received. So if you watch CNN, guess what? You're going to get subluxated. If you watch the news, guess what? You're going to get subluxated, because there's no hope. There's no strength. I mean, when we look at the news and things like that, it's like a dogma. It's like it's fueling the fire. Like, you got to get hope. Go to church. Like, listen to something that gives you motivation and love and kindness. Like, we need more kindness, things like that. And so if not, you're going to get subluxated. It's causing misalignment. Your nervous system is going to shut down. That's your thoughts. Your toxins is the things that we put inside our bodies. what we've really been talking about for the past 3 weeks. All the toxins that we put inside our bodies, bad fats, lots of sugar. What does that do? That increases your sympathetic nervous system, and it causes this lockup in your nerves. And so it causes like, the people who are watching, like if you eat something that probably doesn't sit well, like if you eat bread and it's going to tear up your stomach, like you're doing that to yourself. And so what is that going to do? Your back is going to lock up, your stomach is definitely going to lock up, and guess what? It's going to cause a subluxation, which is what? It's interfering with your nervous system and your body's ability to heal. Same thing with trauma. Trauma is the most common reason. If you fall on your hip, you fall on your back, your head, guess what? Your spine is going to misalign. Car wrecks, things like that, falling off ladders. I can't tell you how many times I've seen people fall off roofs and they come in here and say, I fell off a roof. Because there's a lot of roofers out here on roofs, and they have nothing to protect them and things like that. And guess what? That's going to subluxate your spine. And so very important when it comes to nutrition, what you put inside your mouth affects your spine. And how does it affect your spine? It affects this, your joints. Your joints. Your joints are when two bones meet, you have cartilage around there and you have synovial fluid. Synovial fluid is the fluid that allows you to move your knee. It lubricates right here. It allows you to do this. Your hips to go like that. You need that lubrication. You need that cartilage. You need that joint in order for you to move. And so when you put bad fats, toxic chemicals that are in processed foods, genetically modified organisms, when you put, remember, you are what you eat. And so when you're eating a cow that's been injected with hormones and antibiotics, and you eat those and grain-fed cows, guess what? That's going to go, and then your body, it's going to affect your joints. It's going to increase inflammation, because sugar, what does that do? It increases inflammation inside of your body. And I'm going to show you what else it does. But it's going to cause all these things. It's going to affect every single joint. And so it's crazy because when people come in here and they eat a lot of sugar, you can tell, oh yeah, I'm just achy. Achy everywhere. I'm just achy everywhere. Well, what did they eat that night? Your body's trying to process that and things like that, break it down and things like that. And it's because of all these bad fats. So it affects your joints, especially the joints of the spine. That's how you get low back pain, neck pain, things like that, mid-back pain, especially the joints of the spine. And it's due to this. We talked about this, but right here is advanced glycolytic end products. You remember that? We talked about the, I think it was last week and the week before, but basically, AGEs, what it does is, this is when you eat a lot of sugar and bad fats, like toxic bad oils, like vegetable oils. Remember, vegetable oil, they don't squeeze vegetables and oil comes out. No, this is man-made. This is a chemical that you put inside your body when you cook with vegetable oil and things like that. And so, like, the best thing to a good fat is like coconut oil. Those can be heated in a high temperature and not change the DNA, not change the RNA of the good fat that got created. And so olive oil, you don't want to put it in a high temperature. You don't want to cook too much with that. Above 250, I probably wouldn't cook with olive oil with it. Coconut oil is the best. Even not grapeseed oil. Avocado oil. Avocado oil is another good oil that is good to cook with and things like that, and can go to high temperatures. But as you can see, AGEs, this is what it does. It affects your diabetes, of course, but osteoarthritis. Osteoarthritis is what the majority of people here in the U.S. struggle with. That's arthritis. It's just called osteoarthritis. And so AGEs right here is caused oxidative stress. And so when you eat bad foods, it goes inside your body, and of course it starts oxidizing cholesterol. When you oxidize cholesterol, then that's what creates plaque in your arteries. That's what creates all these different things right here. All these conditions. Your heart, of course, heart failure, hypertension, osteoarthritis, affects every joint in your body. Stroke, Parkinson's, Alzheimer's. I mean, I can go on, but it just starts affecting every single system in your body, not just your joints, but every single organ inside your body. It starts creating all these things right here. And so that's why it's very important for movement. You got to move your joints. But not only that, I think it's very, very important. Also, omega-6s. I think you understand what omega-6s, do you know what omega-6, we talked about that last week. Too much omega-6 will cause all of this right here. Omega-6 is caused by bad meats, too much dairy, too much bad fats, hydrogenated oils, things like that. Too much sugar will increase omega-6s, and guess what? The ratio of omega-3 and omega-6s, which should be 2 to 1 or 1 to 1, the average American, with the average American diet, is 20 to 1. And so what that does, yes, that's screening heart disease. That's screening high blood pressure. That's screening inflammation. You're going to be achy if you're eating too many omega-6s compared to omega-3s. And so you need, good fats have omega-3s in it. And so like you got to replace your bad fats with good fats. And it's good to have a good supplement. Joint health. Joint health is one of the, research is supporting that rapid relief to joints in as little as 7 days. And so a lot of people take this right here. If you having joint pain, if you're having inflammation in your joints, like I would get a good whole food supplement. This has the ingredients is Apress Flex. It has type 2 collagen and gingerols. Those are used for your synovial fluid and your cartilage, to rebuild your cartilage. You need those things inside of you in order to have good mobility and fluidity with all your joints, so you can walk and not get stuck, especially with your hips. If you're having hip pain, things like that, you want it to keep moving. You need some type of good whole food supplement. Joint health, we have it here in the office. I can post a link for those who are online. And so, and another thing, when it comes to your spine and your nervous system, I talk about this all the time. Your microbiome, your gut. Your gut is your immune system. 80% of your immune system is in your gut. Very often, if you are taking antibiotics, this is big, if you're taking antibiotics, like you have to replenish your gut with good bacteria, because an antibiotic is a nuclear bomb to your gut. It destroys good, bad, ugly, everything in your gut. And so the more antibiotics you take, guess what? Your immune system comes down, because your body's not able to fight that. You need good bacteria. You are born with a lot of good bacteria in your gut, and that bacteria actually creates it helps you clot. It helps you clot your blood. It creates vitamin K for you. It helps you with your immune cells. It helps you absorb good nutrients. It helps you fight other viruses and bacteria. Your gut has so much to do with so many things. However, like your microbiome also will fight any type of inflammation that tries to fight you and tries to increase the tension in your joints. And so that's why you need a good probiotic. You need a good probiotics, at least 50 billion IUs or more. Probiotics every day that you take, especially if you're having an immune system issue. Like, you need good probiotics. There's a lot of things like fermented foods, like kombucha, kefir. Those are great foods in order to replenish your good microflora. But there's so much studies now, and we used to 20 years ago, they had no idea what this was. They had no idea what this was. Now there's so much research into it, because they're relating leaky gut. We talked about leaky gut, how detrimental that is to your health. And in order to replenish it, like you got to do some fasting. You got to put some collagen or bone broth into your system in order to clean out and replenish the lining of your gut, if you want to do that. And so microbiome is very, very, very important to your health. This was a study right here. This was done in fibromyalgia patients. This was in the Pain Journal. Pain Journal is one of the top journals on the planet. And so what they found is, fibromyalgia basically is, I'm not sure if you ever heard of this, but basically you have nerve pain, nervous system, nerve pain all over your body. You touch someone and if you know somebody with fibromyalgia, if you touch them, they're going to jump most likely because they're just in constant pain in their muscles and their joints. So they did this study right here in the Pain Journal, and they took 19 species of bacteria. That's what they found, 19 species of bacteria that were either increased or decreased in individuals with fibromyalgia. So they saw species in their gut that were increased or decreased because of fibromyalgia. And so this was the first evidence, at least in humans, that the microbiome could have an effect of diffuse pain. And we really need new ways to look at chronic pain. So they just related fibromyalgia, chronic pain. There's a lot of people who are watching that are in this office that are struggling with chronic pain. And you have not took the time to look at your microbiome and in your gut. And so this has huge, if you start replenishing your gut bacteria, guess what? Your chronic pain will decrease. Very, very important. And other things. And so minimizing toxins, basically when we talk about minimizing toxins, so cosmetics, especially women, cosmetics. And so in our next session, we're actually going to really dig deep into this. I'm actually going to have guest speakers come in and talk about this right here. But with cosmetics, there's many things that will influence and will actually decrease your immune system and affect your nervous system. The things that we put in our skin, the things that we spray, the things that our makeup, things like that, very, very important, our cosmetics. There's 3 different toxins that are in makeup. Phthalates. Phthalates are what they put in plastic bottles. Basically, they put it on plastic bottles in order to make it more durable. And guess what? We put that in our skin, in our makeup, and things like that. Another thing is polyethylene glycol. Polyethylene glycol is antifreeze that you put in your car. And then a lot of women and men are putting that in their skin, in deodorant, and things like that. And so you're putting antifreeze inside of your body. That's a toxin. Another one is parabens. Those are parabens are like hormone disruptors. That's in a lot of baby products also. Those are hormone disruptors, parabens. So phthalates, parabens, polyethylene glycol. So the next time you go shopping, the next time you go get your makeup from Ulta or from Walgreens, whatever it is, you got to look at the ingredients. And so when you look at the ingredients, and if you have anything that I just said, you got to find better products. There's a website called EWG. I think I talked to you about this before, but EWG is a great. If you're kind of iffy with a product that's gonna cause toxicity inside of you, go to EWG, put it on the website, and it will rate it from 1 to 10. Okay, this is the best product for you. That's less toxic. Very important because you don't feel these things. Toxins accumulate. EWG. There's also an app also that you can do. But it starts affecting your skin, your hormones, and things like that. There was a study, I want to share this study right here, that was done with mastectomies in women. And what they found aluminum when they did mastectomies because of the deodorant they were using. Aluminum is actually is a carcinogen. But not only that, it's a neurotoxin. It starts affecting your brain and things like that. But they were seeing, So toxins, basically when you put aluminum in your deodorant and things like that, and you do that, guess what? Toxins can come out, toxins can come in. And so it's normal to sweat. You're supposed to sweat. That has to get out of your body. That's taking toxins out of your body. And so it's very, very important. There's many good, this is some good products for women. If you're looking for makeup and stuff like that, there's lemongrass, Melaleuca. Melaleuca is what we use right here. It's a website. We're going to have, not next week, I'll be going out of town next week, but the week after is going to be our next level nutrition and detoxification. We're going to have 2 guest speakers. One of the guest speakers is a representative of Melaleuca. Melaleuca has around thousands of products and very non-toxic products. And so they're actually going to talk about this right here. But these are non-toxic products right here. They also have non-toxic chemicals also. Non-toxic chemicals also that they put in their skin and things like that. Beauty Counter. Beauty Counter is a little bit expensive, but it's worth it because they're non-toxic. Beauty Counter. Jason's, Schmidt's. Those are all different types of products that you can actually go online. They're in Kroger, some in Kroger and things like that that you can get that's less toxic. Household cleaners. Household cleaners are one of the biggest, a lot of household cleaners has formaldehyde. Does anybody know what formaldehyde is? Yes. So formaldehyde is basically they embalm dead people in there. And so they can be preserved. And so very, very toxic. It literally affects your brain consistently. It's a neurotoxin. And so a lot of these household bleach, all these different household products that we clean and things like that, guess what? When you're done cleaning, you're sniffing. Those Glade things, like that's all toxins. All toxins. And so, and you accumulate that over the years. And so, very, very important. There's a lot of different household cleaners. When the representatives comes, they're really gonna Melaleuca represent. They're really gonna talk about household cleaners and things that we can spray our house with and things like that and clean with. Very, very important. And like I said before, it's an overflow. Medicine deals with this right here, symptoms right here. But they always neglect this right here, whatever's causing it. My job as your doctor, as your chiropractor, is literally, we have to take this out, clean this bucket out right here. Because the more we can clean this bucket out, the less we have to deal with this. It's like, I heard this story one day between chiropractors. One day there was a medical doctor and a chiropractor running in a beach. They were running on a beach. It was a beautiful morning. And then all of a sudden, they both look to the ocean, and there's somebody drowning. There's somebody drowning. They sing, help, 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 help. So the medical doctor goes and saves them, brings them back, revives them, boom. And then, but then he looks to the beach, and then boom, there's somebody else drowning. And he's like, what? Hey, can you help? And so, but the medical doctor goes, he rescues them, he revives them, he's alive. Then he goes back, and there's somebody else. and the chiropractor's sitting there like, what in the world's going on? Why do people keep drowning? Well, he goes and he looks up, and there's a bridge, and somebody's throwing people off the bridge. And so what he does, he goes towards the bridge to stop the guy who is throwing people off the bridge. And so the difference between medicine and chiropractic is just that. We try to get to the cause of the problem, try to save whatever's stopping, so that those people who keep drowning, there won't be nobody else drowning. Does that make sense? And so like you got to get to the cause of the problem. And the cause of the problem is this right here. Is all the toxins and the molds and the food and things that you put inside your body. It creates this bucket to be full. Then you have these symptoms. You can band-aid these symptoms all day long, every sneeze, every cough, every fever, whatever it is. However, if you never get to the cause of the problem, which is right inside of you, and clean this bucket out, you're going to continue to get sick and sick and sick and sick. And so it's very, very important. We got to clean that. Your mindset, as a man thinketh in his heart, so is he. This is very important because one of my pet peeves, when someone comes in, they claim that I am diabetic. I have cancer. I am a cancer patient. I am a cancer survivor. And they just claim their diagnosis. I have this and this and this, and then they have a mountain of medications that they do that they take every single day. And so, like, they claim, first of all, you have to believe that you're healed. You got to believe that there's hope. Like, you have to believe in what God created inside of you. He said, by your stripes you are healed. That's it. Leave it like that. Don't try to paraphrase it. Don't try to put a question mark or anything like that. Just, it is what it is. You got to stand for some type of truth. And my truth is His Word. That's what it is. As a man thinketh, so is he. So it's very important to value your health. If you don't value your health, then the decisions that you make, guess what? Is going to represent that. The consequences that are going to have is going to represent that. And so, like, you have to be able to value your health. Like, I'm going to do this, this, and this because my health is important to me. I mean, health is wealth. I hope 2020 has showed everybody that health is wealth, because the world has changed in regards to health. But the world has changed in regards to, wait a minute, I need the government's help for my health. I need the insurance company's help for my health. I need a pharmaceutical company for my health. No. You're responsible for your health. I mean, you have 100% responsibility for your health. And it's like, I truly believe in informed consent. You have everything in front of you, and you choose. So you have the information in front of you, and you make the decision for you and your family. That's an informed consent. Without being forced, without being pushed, without being threatened. That should not be healthcare. That is not healthcare. You should not be threatened. You should not be pushed. No, like, you have the information in front of you, and you make the best choice from the evidence that you have in front of you for you and your family. That's an informed consent. And so what's going on in our society right now, that it's getting away from that. They're forcing people to do many, many restrictions and things like that. You should have some kind of decision making in your health. It's your body. And what you do with your body is your responsibility, and it's the consequences you reap because you chose with your body. It's very, very important to understand that. Just because everybody is doing it, don't be afraid to stand out. Don't be afraid to, okay, if everybody's doing this, like, okay, I think this, my choice, okay, I'm going to do this right here. And you feel from all the evidence, from everything that's in front of you, I made this choice right here for me and my family. Very, very important that you cannot blame your insurance company. You cannot blame the government. You cannot blame your mommy or daddy. You cannot blame your pharmaceutical company for your health. You're 100% responsible for that. And so this is another thing. As we age, we're expected to get sick. This right here is so far from the truth. Like, as we age, we're supposed to get more vibrant because you're taking care of your body. This all has to do with the choices that we make, especially as we get older. And so, like, yes, your body starts slowing down little by little as you age. However, you don't have to get constantly sick with all these sickness and diseases. That, I mean, people used to live to, 110, 120 years old. I mean, people used to live long lives without any type of drugs, without any type of dependency. They just lived because they moved, they had to go. literally across town to get their food, come back for their kids that had to work, things like that. Things have changed. I mean, now it's very instant. But like research yourself is really now showing just on your gene level in your cells. They did a research, I think it was the University of Albany. They did a research on people who were retired. I think I mentioned this before. People who were retired, when somebody asks, hey, what do you do? Oh, I'm retired. I'm retired. I'm retired. And they, hey, what do you do? I'm retired. And all these people that were retired, they kept saying, I'm retired, I'm retired, I'm retired. And what they started studying was their cells. Their cells literally started retiring on them. Their cells started actually decreasing, dying, started functioning less because of what they said and what they thought. I'm retired, I'm retired, I'm retired. Well, their cells, literally your body responds to what you say. It's very, very important. Now, maybe switch those words. If you say those, I'm living my best life. I'm living in abundance. I'm living in health and wellness. And so like you have to change those words in order so you can walk more vibrantly, in order to walk the talk. And so like it's very, very important. Like this is, I mean, it's a mindset. I mean, I think being unhealthy is a mindset. This is just what you've been taught. This is what been carried out through generation and generation. Well, change that. Like change your generation. Teach your kids differently about health. And so this is the time. And so it's all about a mindset. You got to switch that mindset that you are wonderfully and perfectly made. There's nothing broken, nothing missing in your life. Like health comes from within you, not from outside of you. All you have to do is take care of what's inside of you. We're not machines. We're literally one whole being. We look at you as a whole being. If something's going on with your liver, you got to it's affecting your whole entire body. It doesn't just affect your liver. And so like I always like to say, you're the greatest cardiologist in the world. You're the greatest endocrinologist in the world. You're the greatest oncologist in the world because the greatest doctor in the world is inside of you. It's just you cannot interfere with it. You have to allow it to heal from the inside out. You have to give it what it needs, remove all the interferences, and then God does the rest. And so I know I'm passionate about this because this is my livelihood right here. Like I see too many miracles in this office. I see too many people get off the medication. I see people, and then on the other side, I see people outside of this office dying quicker. Getting on all these medications, having all these diagnoses, and they have no other way. And they go down this spiral, and they feel discouraged and broken. It doesn't have to be that way. And so when it comes to oxygen and exercise, very, very important, it's movement. Movement is very, very important. And standing is the new smoking, they say. Because it's degenerating your spine. It's increasing arthritis in your low back and in your neck. I mean, I think 40% of my patients are like this, and they have a sitting desk job. And so when you do that, that rolls your shoulders, it brings that, you get back pain, neck pain, things like that. And guess what? Those same nerves go to your heart, lungs, high blood pressure, things like that. So it started degenerating me. Between sitting and standing is better. But you can't just stand, that's it. You got to move while you're standing. And so it's very, very, very important. And it has to do with, these are the Max Living wobble cushions right here. This is, if you're working at a desk job, this cushion, wobble cushion, is very, very important that you can increase mobility in your spine to put more nutrients into your disc spaces. And so I had a study, I'm not sure if it got erased. I think it may have been erased. Okay, yeah. Another thing, a lot of people think, having a standing desk is good, it's a whole lot better than a sitting desk. But having a standing desk can only do so much if you're not moving. You got to be able to move. This is a good So you know the workouts, deadlifts right here, a deadlift like that, and a squat right here. A deadlift, when you pick up a baby, that's a deadlift. When you pick up something, that's a deadlift. When you squat sitting to standing position, that's a squat. Sitting to a standing position, that's a squat. A deadlift is bending over, picking up something like that. The older you get, the more you got to practice that every single day. Because that's the movements y'all do. That's the movements we all do. We sit, we stand, we sit, that's a squat. So what's a good exercise for older individuals? Squat. Right here. Hold on to a wall, squat. Right here. Sitting from standing. Sitting from standing. The more you do that, guess what? The less hip pain, the less back pain, because there's movement. A deadlift, you go like this. Right here, you pick up something, you bring it up to you, you bring it down, you drop it, you let it go, you come down, you pick up something. You do those little movements right there. You do it like at least twice a day. Do like 15 to 20 of those little movements right there. You do that every day. Then when you're actually not doing it, and you're actually sitting to standing, or you're picking up your grandchild or something like that, or you're picking up something, your body's already used to it. Yeah, you've already trained your body. Okay, this is what I do, and that makes it easier when you're working in the garden, when you're moving, when you're doing other things that you don't normally do, because you've practiced and you've worked that out, you're less likely to get injured. Very, very important for those movements. Squat, deadlift. Very, very important to do. And so medicine is about disease and what makes people die. Chiropractic is about life and what makes people live. I focus on life. There's many things that can kill you here. You can't control much of that. But you can control if you want to live in headed towards life or death, one or the other. And so the things that you do with your body and allow your body to have and go inside, that's life. What life-giving food, life-giving exercises, life-giving adjustments, life-giving mindset. Everything's life-giving, 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 or death-giving, death-giving, death-giving. You're just waiting till something bad happens. Like, that's not, if you want to live for longevity, you have to start thinking and believing that you are. The same thing that happened to your mom and dad doesn't mean it has to happen to you. And so very, very important. And so I'll end with that. Next week, next level nutrition and detoxification. Next week, I will not be here. I have to go to Orlando for some schooling. It's a seminar. I'm taking the team there. However, the weekend after that Saturday, I think it's February 13th, we'll be back here. For those who've been watching, this is the time that y'all can come in here. Like February 13th, this is the time that I would recommend you come here at the office, because we're going to have 2 guest speakers. We're going to have Gerard Mack, which he's the owner from Clean Juice. He's going to share his testimony how nutrition and juicing has transformed his life. And so to a guy who ate McDonald's every day, to someone who now is an advocate for nutrition, he's going to share his testimony. And then we're going to have the Melaleuca women who's going to drive from Baton Rouge to come here to speak and talk about non-toxic products and how to actually detoxify your home, clean your home, and things like that. Very important. If you are in town, I would be here. They're going to have free samples and stuff like that. It's going to be a good time of fellowship. And then after that, the weekend after that, it's going to be about exercises. This is what, bring your workout clothes. We're actually going to be working out here. Nothing hard, but after that, every Saturday, I'm actually going to be working out with you on Saturdays here. So thank y'all so much for being a part for today. We love you. If you just, if you have not shared this, please share this, like it, comment, and then tag somebody. Thank y'all so much. Awesome.